India and a PhD scholar at the National Resource Center for Value Education in Engineering, IIT Delhi. His doctoral work sits at the meeting point of computational neuroscience and contemplative practice using functional MRI to study how meditation and yoga shape brain function. He completed his BNYS from S. Vyasa University in 2021 as the university distinction holder, securing the highest marks in 8 subjects. He went on to earn an MSc in yoga therapy, mental health, and neurosciences from NIMHANS, Bengaluru, with first class honors in 2023. His training also includes a certificate course in integrative medicine from NIMHANS, a fellowship in neurological rehabilitation, and a fellowship in epidemiology and biostatics accredited by UNSW. Sydney. Dr. Bansal has authored more than 20 peer reviewed papers in journals, including Curious, Medical Acupuncture, Current Problems in Cardiology, the International Journal of Yoga Therapy, and the Journal of Integrative and Complementary Medicine. He has contributed chapters to a Springer volume on yogic practices and to several edited handbooks on naturopathy, pranayama, and integrative healthcare. At CCRYN, he serves as project coordinator on multi-centric clinical trials examining yoga in pulmonary hypertension and yoga-based cardiac rehabilitation. He sits on the editorial boards of Medical Acupuncture and Advances in Integrative Medicine and has completed over 170 peer reviews for more than 28 international journals. He has delivered over 40 invited lectures at institutions including ISRO, NIMHANS, AIMS, and several state and central universities, with talks also presented at international forums of Belize and Nepal. He founded Own Your Growth, a non-profit that links BNY students with senior practitioners across India. His core research interest lies in neurophysiology, neuroplasticity, cognition, and integration of yogic and naturopathy methods into mainstream healthcare. I extend a warm welcome to you, sir. Over to you.
So, good afternoon, everyone, and thank you for very kind invitation and the kind words which you have invited me with. So many discussions which we have done with Dr. Praneet sir, and he's principal of Yenopaya, and I would like to thank the institution that you have given this opportunity. And I would see that I'm not able to see anyone. Are you there? Students are there? Yes.
Yes, students are there.
Yeah. Okay. So can I see the screen where you all are visible?
Bhavit sir, actually the camera has not put up for them. It's a
Okay. Okay, no issues, no issues. So we will start the discussion. I would, if anybody in this group, do you know that why we are meeting today? Anybody like from the group would like to talk, any one individual, okay, why we are here today and why we would like to have this discussion. Anyone? No one is there? Okay. Or like Dr. Vinay, they can talk or like it's like they can listen to it, how it would be. Dr. Vinay, are you there? Am I audible?
yes sir, you are audible, sir.
Yeah. Is there anyone who can interact or just I have to speak how it would be?
Actually, it's visible in a single screen for them, the entire
Okay.
session. Few
Okay.
of them have joined through their phones. So those who have joined, they can interact actually. Others
Okay.
are viewing you in a bigger screen.
Okay. So how many students are there with us today?
Around 41.
40, 41. Okay. So they are of different years or they are from final year or how it is?
Final years, sir. Final years and
Final year.
interns are there.
Interns are there. So basically, so today, and they all have research exposure, basic research exposure, what they are looking into it.
They are they are have done few of the narrative reviews recently in the final year. So they want to learn how to publish, how to search the journals, all those things actually.
Okay. Okay. Thank you, Dr. Vinay. So welcome to everyone. And today, what we are going to discuss about that why we are here today. Okay. So think like a scientist first. That's what I'm looking for. Okay. The the consider that you are whatever you're writing today in this journal or in this article should not be the only priority for you all. Okay. So today, whatever we are going to discuss, make sure that that should be a kind of a exposure to you that how you are going to approach. You all have a mobile phone as I got the information. So please be on it. We would have some task to finish. It would be hands-on training. So we make sure that whatever you are doing, it is connecting to all of us. Okay. So think about it. Whatever you have done till today and how we are going to change that understanding from now. Okay. So let's begin with that. So what we are going to talk about it. So first, my goal should be that you should not think like that I should have two research papers, three research paper, five research paper. So my basic concern whenever we start in the research journey, please think like a scientist where you have a curiosity, you have a doubt, you have an opinion over evidences, whatever anybody has created in this yoga and naturopathy, you should have opinion on that and you should report honestly. So whatever we are doing today, you should focus on curiosity. So have you noticed something very real? Like we talk about patients on 12-week program sleep better. This we have heard many times, multiple times we have heard about it. But do you know that it is a correct thing? A scientist should ask, is that true? If it is true, for whom and why? So that kind of curiosity, if it is existing in your understanding, existing in your what you say, curiosity should be there on that function, that why it is happening. Okay. Or is it true, for whom and why? Okay. Then second would be the doubt. Okay. Maybe it was a routine thing, the tension or the season, not the asana. Okay. So as a scientist, we should try to prove before anyone else can. So you have so many ideas, you have written narrative review. How do you see that narrative review is going to help a clinician or change the evidences, whatever we have today? I would ask you, okay, whatever the evidences we have, think like a scientist that whether it is going to contribute anything in our career, anything in our the research and the scientific journey. Okay. And I would say that next, that whatever you see in narrative review or whatever you see in a clinical trial or whatever you see in any basic study, even a case report, please report what happened as it is. It should not change. Okay. So why I'm talking to you about all these things, that first think like a scientist, or the real goal is change what people do. Because I have seen in multiple sessions in the multiple colleges with different students, they ask only one thing, sir, can we have a paper? Can we publish two papers in this year? Can I have three papers before I finish my BNYs? Paper should not be the whole criteria for you all. See, if you think about that, I should have 10 papers, I should have 12 papers, it is not going to make any difference. If you come out for a researcher to become a scientist, what and all thing is required is anything creating a knowledge based. So add to knowledge. Are you filling the gap? If you're filling the gap, example HRV changes after Jalandhar Banda. This is an example, but it is filling the gap. Yeah, there are changes with HRV because we talk about HRV a lot in yoga studies. So that is one thing. Is it improving a patient life? A naturopathy protocol which is safer, more consistent, and applicable at the clinic level, a grassroots level. Can you do that with your research? If yes, your work is good. And it should guide the next researcher, your juniors, or upcoming scientists in the field of yoga and naturopathy that your methods, the chosen methods in your process should be replicable. Means today I am doing one study, I have published one study. Tomorrow, if you want to replicate those kind of studies, it should be replicable. Okay. And please make sure that whenever you write an article, be honest and write your limitations. If you have these things, these three goals in your mind, and when you publish an article to any journal, would be accepting 90%. Okay, so a paper read by nobody or in a journal nobody trusts changes nothing. So suppose I have a 15 published articles and you nobody is reading about that and journal is also not so good. Do you think my publication or my having 10, 20 articles is going to change what people are thinking? No. Where you are going to publish your article, as much as you write is important when you talk about publication. So we have this habit of student reflex because I felt these are the things which I was going through. It worked for my patients. We do talk about that. But if you think like a scientist, because I want you to think like a scientist, not like a researcher also. So your goal, your approach should like a scientist. Okay, if it is working, worked as what? Okay, then how much measuring in what kind of population? It worked for my patient if I describe in these three things: worked versus what, measured how, and in whom, means what kind of population, then I would be able to tell you that this is a perfect thing, like it is working for my patient. Then we talk about, as I said, I need a paper for my CV. You should not talk like that. You should have a, I have a question worth answering. So whatever you have a question or a research idea that has an answer through your research, that should your approach. Okay, the data did not fit, so I dropped it. It is not about that. The data did not fit, that's a finding. So always you will get answers, that's not a research. Most of the time what happens, what we think about research, what is our ideal goal to approach a research, most of the time it fails. When it fails, we should accept it and publish it as it is. That's a finding. That's called the research, and that's what we are looking for. Any journal that accepts fast, the journal my readers actually trust. So you have to worry on this line, any journal that accepts fast. Why? Because the journal, you have to say that the journal my readers actually trust. So that's why my papers, my approach is getting accepted. So what we have, this is your idea to print. So your phone should be on, as I'm not able to see you anyone and Dr. Vinay is there. So if I want to communicate, I will communicate with Dr. Vinay, but make sure that now your phone is on. You will have 5 tasks which you have to build and there would be a time frame. So Vinay, are you there?
Bhavit, sir.
Yeah. So what you can do is,
Actually, the thinking
you
arrangements have been done like this. I will just show you on camera.
I am not getting your voice. Yes.
The seating arrangements have been done like this. I will just show it on the camera for just for your reference for the
Sure,
students and
sure.
this thing.
Okay. So a full class is full. Thank you. Okay. So what I want, Vinay, keep a stopwatch when we are going to give task to them during this presentation. So we cannot exceed the time limit. So please, if it is 5 minutes, they will have only 5 minutes to do it. So make sure that we are not crossing the time. Just think about it. Okay, so we will start doing the task. We will have 5 short tasks to finish, where you will build search on your phone. Okay, so your phone is everything today. Okay, so what we are going to do today, that from idea to in print. I got a question like Dr. Puneet said, okay, you have an idea which has been written somewhat, or you have an idea which has to go in print, means it should get publication. So I have few things before we begin it. the question which you are working on, the writing structure, the checklist, the journal, and the submission. I believe the question and the writing is somewhat clear to you. If it is not, we will try to cover it in other next slides, but not right now. So make sure that your phone is on and we will finish the task. You have already the idea, most of the students. If you do not have any idea, try to think a new thing, a new idea, and let's start working on that. Okay. So by end of this part, you will have a written one researchable question in Pico format, your own. So you have the already a research question. If not, just write it. If you have, then use the same thing for this search. Just verify whether you, whatever you have written, is it correct or not. So we go with the five things. I have written examples for you all. Please make sure that it fits when you understand. Whenever you think about any idea, we always tell it should be feasible. So realistic idea should be there, means do you have the patience? I'm giving you the complete timeline. Do you have the patience? Do you have the time? You have the equipment and the skills. If you have all these four things with you right now, you can do a trial or your idea is good to go. It means it is feasible or realistic. Now, second thing, it comes interesting with clinician or patient, or if I'm a funding agency, actually you are giving an answer to a clinician, patient, or funding agency. Today, there is a like funding from ICMR for anemia. Whether do you have an idea which is feasible, having patient time, equipment, and skills? If you have everything, then yes, it is going to interest a funding agency to fund you because it is helping a type of a population which is helping a clinician to work on that. Okay. Is it novel? So if you write that yoga is good, it is not novel. But if you say that yoga, if you practice yoga, it lowers the blood pressure, it might be helping a patient, then it should be ethical, means you should get an ethical approval, and it should be relevant in the field of policy and practice forward. So if you have written a narrative review today, and if you have a research question, and if you have all these five elements in it, then I would say that your approach is correct. Again, I'm telling you, it should have the patient population should be clear, time, equipment, skills, whether it is going to help clinician population, patients, or the funding agency. It should not say that yoga is good. It should be specifically that yoga is going to change. What is that change? That novelty you have to find out. It should be getting ethical approval. And next, please make sure that it is related to your policy and practice forward, means what you are going to do in the next. So it is not just for your CV. I have written this CV word. Why? Because I have seen many times that we are doing work just to write papers in our CV so that we can get jobs. But today the challenges, I'll tell you, if you go and sit in any interview, they will ask you three things. Okay, you know the research, how you can think about an idea, from the idea to the print, can you do individually? You should not get support for anything. If you can approach from zero to the end product by yourself, then you can be selected in any kind of jobs, because that will give a confidence to the recruiter that you know everything from zero to the end. So making sure that you are just giving the idea to a policy or a practice forward. So we know Pico, you have already written that. I'm just giving a brief if somebody is new in this conversation. The population, like for whom we are working, what you are going to do on that population. Comparing means what? Means, are you comparing your therapy with some other therapy? If yes, then you have to mention that. And what are the outcomes you are going to measure? So I have written three examples. I'll read about acupuncture or massage. In chronic low back pain, that is your population. Does electroacupuncture, that is your intervention, versus sham needling, that is your comparison, improve pain, which is a visual analog scale at 6 weeks, that is your outcome. Now, if you see the slide, it is very clear. Your idea should be clearer like this. Now, in the next slide, I'm going to give you a task. If you have an idea, still you should write like this, because at the end of this conversation, whatever the notes you have written, you will mail it to me that what you have understood from this whole 1.5 hour workshop. So making sure that Again, one more example I'll take. In obese adults, which is your population, does a 4 week structured fasting plus raw diet, that is your intervention, versus standard diet advice, that is your comparison, and reduce body weight and CRP, that is your outcome. Again, if you have clarity like this, so that's why I have given an example which will help you. So now, if you have already a research question, please arrange in this format. Open your phone. Okay, in this 6 minutes is given, but I was informed that you have the idea already. So I'll give you 3 minutes where you have to pick one condition. You can actually see insomnia. Examples are there. Write your PICO. Okay, don't skip the comparison part that is required. And if you're writing the narrative review or a review, should be the same. Okay, then read it back. Does it tell you who, what versus what, and how you'd measure it? Means to confirm whether your thing is working or not, you have to make sure that it should give four answers to you. Does it tell you for who and what versus what, and how you are going to measure it? Tighten anything vague and name a measurable outcome. So if you see the example in adults with insomnia, does yoga nidra versus sleep hygiene advise improve PSQI score at 6 weeks? This is an example which we have understood in the last two slides. Now you have the phone in your hand. You have the notes application will be there in each Android phone. Please open it. You have a 3 minutes to complete it. Dr. Vinay, are you there? Can you just put a stopwatch for this?
Yes, sir.
Yeah. And we will make sure that whoever is doing this work, 41 people, should submit via email to your institute and CC to me that what they have understood, means if they are working, because they will have answers. So there are 5 tasks should be there in your phone today.
Sure, sir.
So Dr. Vinay, are they working on it?
Yes, sir.
Okay. Those who are working from their phone and attending individually, you can send it via chat box. So we'll get to know any 1 or 2 people. So is 3 minutes finished, Dr. Vinay?
Yes, sir.
I believe they have written it. Just you can check once if they have written, we can move forward.
Still writing it.
Okay. You just update me, so we will go fast for the next. So, okay, let's move forward then. Let's go to the next because already time is less. We have 5 more tasks. Just waiting for you, Dr. Vinay. So if you say, then I'll move forward.
So we can move forward. We'll post it in my chat box. If you of them have done it.
Okay. So we will move forward. Okay. So I'll go to the next. So now you have written the paper or you write a paper, but there is a format you write it, but it should not leak into the wrong one. So basically what we should focus on, there is one few lines are there if because already you have written it. So I'm not going to talk much. If time permits, there is few things we can discuss how to write it. But now we should focus on that. I have written that what should be written first and the next. So if you see this slide, introduction. So you should be focusing on one aim. You should not have multiple things in your introduction. If you're writing a review also, means you should look for one answer. What it could be, an example, that acupuncture is used for migraine, but evidence on frequency is mixed, which we are looking for. So we are testing 2 versus 1 session per week. And that is how you are trying to find write an introduction. Means you have to focus on one aim, which should be going to the answers. Methods. What do you know? Methods, it's like kind of a recipe, like how you are going to cook your complete dish. So what is it like? Which, if you are talking about the massage, which strokes, pressure, minutes, oil, therapist, training. So all these things should be there. If it is going to be about yoga, then it should be like what you are going to write is frequency, duration, therapist. Okay, the type of intervention, what is that protocol? All these things should be there. And when you are going to write the results, please make sure that only mention the numbers whatever you have seen. Okay, even in narrative review, what you write in results, what are the outcomes you are finding from the different papers as a summary. Okay, when it comes to systematic review, you need to do analysis, but when it comes to the narrative review, you do not need to do an analysis. Okay, so you just show what you have seen in your complete study, and discussion is like what you are going to interpret plus limits. Like you have to compare your introduction, your methods, your results in the discussion with the previous studies. I'll go to the previous slide. Most 99% paper is in the same shape, where you will write the abstract in the last. Okay, introduction, what you're going to do it, why this question matters, what's known, the gap, and your aim. If these are the four things which you write it in a sequence, it is finishing your introduction. Again, journal wise, the word limit will change. So we will discuss in the future, means in the coming slide. So you should focus on four things: why this question matters, what's known, the gap, and your aim. So these are the four things as required in introduction. Method is like a recipe. If your research, if I want to replicate, I should be able to replicate the complete research. That should be the methods. And results, what you have found in numbers, tables, and figures. You should not write your opinion that, yeah, this is the answer and I feel that this is answer is giving because of so and so. You should not be able to answer, and you should not focus on any opinion in this result section. Discussion is what it means, how it fits prior work, what it means, that is your first paragraph, how it fits with the prior work, limitations, what's next. So there is a wide to narrow, and then you are going to talk about how your study is planned. So what you will write it, when you write a synopsis, you focus on your methods. Then, so this is how you have to write a paper. So if you know how to write a paper, this is a format. First is your methods, then your results, then your introduction, discussion, and then last is abstract and title. Title cannot be finalized till you finish your studies. There are few changes which happens when you do it. So if you're writing a paper today and you write from the introduction, it is a wrong way of approaching a writing a paper. First, you should write a method, then result. When these two things are there, you know the story. If you know the story, then you can write why this question matters, what's known, the gap, and your aim. So how you have to write a paper. First is methods, second is your results, third is your introduction, then discussion, and finally abstract and title. That's why you are going to complete. Okay, so this is how you have to focus on that. Now these so now you have a workshop chat box. Again, the next activity. So you just write one line about introduction, methods, results, or discussion, but make sure that you approach from this. Okay, so what could be your idea? So example, participants were randomly assigned to 8 weeks of yoga or wait list. This is a method. This is an example. So you have to write 4 sentences of your idea, what you have seen right now. Result section will be your hypothesis. Kya, haan, it can be. You will not mention the result. So now open your phones. Please take less time and focus on all these 4 things. Okay, one sentence in the wrong section on purpose, it will make sure that your opinion is not coming correctly. So making sure that you have a 4 things: introduction, methods, results, or discussion. There are 4 things are there. In that you have to write one line as a second task. Example is also there. That same way you have to write it. These 2 things we are not discussing in detail because our today's focus is on publication rather than writing. What you say, okay, how is our idea, how we have worked on methods and all. So today is like publication is more focused. So we will move forward on that. So Dr. Vinay, are you there? Like we have started this second activity.
Yeah, yeah, yeah.
Sure, sure. Thank you. Dr. Vinay, is it finished?
They are doing it in their phones.
Okay, okay, okay. We'll wait for a minute also.
You want them to post in the chat box?
No, not right now. When they finish everything, then.
Bhavit, I think we can continue.
Okay. So now we have two things which why we are doing this activity right now to understand that even the approach, if your approach is not to the point, the writing of the paper would not come what you're looking for. So make sure that you write it in this format. You remember this 5 points: methods, results, introduction, discussion, abstract, and title. Then you would be able to write it completely because it should look like a storytelling. Okay, your everything is perfect. You are going to tell a story that way you should be doing that. Now this is a very important task where also your phone is required. Now we have written everything. So before we have just understood the process that what we are going to write it. Now we have written everything, but for a journal to accept your writing, there are few checklists. So right now we have a checklist on yoga which is called clarify. You have a checklist on clinical trial, which is all Prisma. Okay, concert, and for reviews is it's Prisma. So you have different kind of checklist. Why this checklist is there? This checklist will allow whether you have written properly or not. The process of writing a paper is done. Now you will match your pointers with the what you're going to match with the checklist. Okay. And every journal today, in this today's era, every journals match your article with the equator checklist. I'll show you how. So if it cannot be reproduced, it is not science. So for me to understand that if your work cannot be reproduced, then you are not going to do a research because that is not helping anyone. So we gave them yoga and they improved. Tells the next researcher nothing. We talk about in many presentations, no sir, our therapy is working. What therapy? How we have given? What time duration? What frequency? Volume of that therapy? So that we have to be focused on, which asana, how long, compared to what, measured how. These are the reporting guidelines have been given in this website called Equator. So we will see right now a checklist of items every reader needs to judge. So when you send your article to any journal, they will check whether you have written properly as per the checklist first thing. Then only it will go to the peer review. Means somebody will review your article to check whether it is a properly written article or not. And it is hosted by Equator. This is a website where you can see all the different checklists, all the journals. I'm telling you, even the Ayush journals in today's time ask for a complete checklist on submission. So for a concert randomized control trial, for acupuncture trial, you have to write with stricta. So this is again a checklist name. For observational cohort case control is STROPE, systematic review Prisma 2020, and you have an updated version of Prisma 2020 also. For a single case report and series is CARE checklist. Trial protocol is SPRIT, and describing the intervention itself, which we have mentioned previously, how frequency, dosage, that is called TIDIR, TIDER. So all these are the different checklist. Suppose you are working. So suppose today you would say, sir, my intervention is good. I would say that your intervention should be according to TIDER. You say, sir, my yoga protocol is good. I will say your yoga protocol should be through the Clarify. You say my trial protocol, then I would say Spirit. So when you write all these different articles, okay, so when you write all these different articles, then you have to follow this checklist. So example is there. Suppose randomized control trial, yoga versus wet list RCT for rheumatoid arthritis pain. Electroacupuncture for migraine, that is acupuncture trial. Observational trial is like diet pattern and metabolic syndrome survey. So if you are doing a survey kind of work and all, strobe is required. Review of pranayama and blood pressure. So if you are doing any kind of review, narrative review does not require any checklist. But if you improve yourself from scoping, systematic, meta-analysis, umbrella review, then you need Prisma 2020. For a naturopathy case of resolved chronic urticaria, then you need a care. Like this, you need the checklist to be followed. So open your phone. This is a website, equatornetwork.org. Use whatever the design you have in your mind. Please think about it. So example, planning a yoga RCT, search concert, download that checklist, and that is your task. And it should not take more than 2 minutes. Just open your phone, see that website, and if any challenge is there, let me know so we can discuss. So Dr. Vinay, we are giving 2 to 3 minutes on this. So whether they have to check with their idea what the uh, idea is and which checklist is according to that, they have to written in their notes.
sir, I think we can continue.
We can proceed. Okay. Okay. So we'll go for the next, choosing the right journal. So please, again, my concern and the concept from the beginning, it is like, please think like a scientist. You have to understand that submitting in a journal of your work means you're looking for the right approach, that whatever the hard work you have put on in your research should be approaching to the right journal. Means the right journal will showcase to the right kind of population. That right kind of population will read your article and will cite it, and citation will bring you the right, what we say, a right idea ke whether your work is really good or not. So having an article and which is cited more and more is the real journey for a researcher. Okay. So before submitting, read the journal before you write for it. First thing is scope and aim of that journal. I'll give you the names of few journals, which we will have one more task on that. So what you have to do is, whatever the idea you have written, even for narrative review, for a study, you have written something, you have an idea, which you have written already in your phones right now. Please make sure that the scope and aim of your study and the journal should be similar. You are writing iJoy. iJoy is one journal. You are writing a naturopathy article to the iJoy. Okay, you are writing medical acupuncture, a yoga article to that. It would not fit. But what will be fitting this? So if you have iJoy, where you are comparing yoga and naturopathy, you have a medical acupuncture where you're comparing diet and acupuncture, then it would be acceptable. So making sure that scope and aim should be there. Then clear audience. You will see in the journal also who is reading that. Clinician, basic scientist, policy makers. That way you have to write your articles. So it should reach to the audience. So suppose if you're writing for clinician, write it like a clinician. If you are writing for a basic scientist, not a behavior scientist who wants to work on the lab and all, then you have to approach in that direction, or a policy making that direction. So your writing will change as per the audience. So first is scope and aim, then your audience, then indexing. Indexing means what? Indexing is a format where the different journals, whatever the journals you are publishing or whatever the journals are available in the market, have a kind of rating. So suppose your journal is PubMed indexed, Scopus indexed, Web of Science indexed. It means it is credible. What do you mean by? Yeah. So if we are talking about, okay, indexing. So indexing is like a rating. So if you are submitting an article, being a PhD scholar, being a MD person, being a BNYS person, make sure that Scopus and PubMed should be there. Why do you need PubMed and Scopus? Because all these journals would be indexed either with PubMed, either with Scopus, either with Web of Science. These what you say, the websites or these agencies like PubMed, what they do, they review the article, they review the journal also, whether the journal is good or not. If the journal is not good, they cannot be indexed as a PubMed index. So what happens if your journal is not PubMed indexed? It means your journal quality is not so good till today. So for a journal quality should be very good, then it should be indexed with either PubMed, Scopus, Web of Science. Mostly for a medical person like us, it is required. PubMed is mandatory for us. If you go for any job and all, for a PhD person who is looking for a doctoral work, then Scopus is mandatory for them. And even for the institution, like any institution in India, if you have a NAC ranking, if you have a NIRF ranking, all these rankings are decided by the PubMed index, Scopus indexed. So it is very important. Indexing should be there for a journal for the quality. Then you have a metrics. Metrics is very important. We will see in the upcoming slide also. How do you see the impact factor of the journal? It means how it is impacting, means how many readers are coming, how many people are citing. Okay, how is the quality of your article? So there is a indexing agency, there is an impact factor agency which review the journals and give the impact factor. Suppose we take an example for iJoy. iJoy is impact factor of 1.2 or 0.8, I do not know. So these means it is very low. It has to improve. And every 3 years, this impact factor will change. If you see Lancet journal, they have impact factor of 40, 50. They are top rated journal, nature journals. So you have to focus on that metrics. Impact factor is very important to know the quality of a journal. It is not your paper quality, quality of the journal. Then you have the site score, means how many people are coming to the journal website, how many people are coming to cite the article which is published in that journal. So what is the key for that? So journals are running based on how many people are citing the article. I am telling you today also, you submit one paper and you have a highest citation on that one paper, and I have 15 paper and no citation, you will be the best researcher. Number of paper accepted is not the key for the researcher or scientist. How many people are citing for that? After all these things, when you are clear with scope and aim, audience, indexing, metrics, okay, then you have to read the author guidelines. What do you mean by author guidelines? Whatever you have written till today has to be similar approach with the journal. If you read about iJoy, I'm giving an example of the journals. iJoy has a word limit for any article of 3,500 words, original article. Then you have to fix your writing in 3,500 words. Okay, how should be the structure? Referencing style. We have a different referencing style. Every journal will ask you different format. If you go to the Lancet, they ask for the Lancet style of referencing, which is Chicago based. If you go to Elsewhere, Elsewhere has a Vancouver. Nature has their own referencing style. Okay, everybody is having their own referencing style, and you have to follow that for your journal. So if you are using Zotero or Mendeley, they have that settings to change the referencing style. Then required checklist, which we have seen equator, and follow the exactly. So all these 5 points you have to follow. Now you have submitted an article, but that cost is $3,000. Today, there are three formats. One is free publication where there is no need of money. Second is subscription based submission, means your article can be read by those people who have taken the subscription of that journal. That is called subscription based submission. Third is APC. You are accepting the article processing charge. I would say for you, you should not go for APC as of now. You should try hard for the free journals and the subscription based model for the good journals, but not with APC. Because if you want to work on 3 articles in a year, one article APC is $2,500 to $3,500, means 2.5 lakh to 3.5 lakh rupees today in today's time. Do you think if you have 4 articles in a year, you can give this much amount of money? That is not feasible and that is not practical also. For a good researcher, please, if your work is really good, then it would be accepted even in subscription based, even in the free journals. So please make sure that cost is very important. Now, the next important thing is, suppose you submit an article in iJoy. In the website, they will mention the time duration to acceptance, to review, and to publish. If I submit a paper today on iJoy, suppose I'm submitting a paper in iJoy, then they will give me in 1 week, they will give me whether it can go for review or not. If it goes to the review in 2 months, I'll get to know whether it will accept or not. If it is accepted, then in 6 months, I'll get to know whether it will publish on what issue. So it means the timeline of the journal, the speed of the journal is also important. Suppose there is one journal called Advances in Integrative Medicine. They take 156 days. Do you have 156 days, almost 6 months? Do you have in your timeline? Because if you are an intern, then in 6 months, so you'll finish your internship also. So you have to find a journal which is on your timeline, which is free, accessible, following the author guidelines, scope and aim, audiences, all these 6 questions. Why I'm discussing a lot in this? Because this is very, very important. Make sure that you read everything, though hidden charges are not paid by you. So what you have to see? Impact factor. How you have to see impact factor? Clarivate. So many people will give you impact factor. Only you have to verify if the impact factor is of Clarivate. Means this agency is giving the impact factor, it is worth it. If you see any other agencies giving you impact factor, there are few predator journals which say 8 impact factor, 9 impact factor, but those numbers are not correct. If Clarivate is giving you 5 impact factor, it is real. Every 2 years it will change, and it is based on the citation. Again, I'm telling you, if your article is cited most, your journal will have benefit, and your article will give you a what you say, a fame, name and fame in the research journey. Okay, site score is like Scopus, elsewhere and all. 4 year window they will have, that how much citation you are having. Citation, how much the journal is cited, means how much the journal is cited is rated by SGR, SciMego. So these are the few different things. When you go to the Scopus has four ranking: Q1, Q2, Q3, Q4. If you go for Q1, that is a topmost Scopus journal. Q4 is the lowest one. So these are the quartile range, which category with top 25% journals with the, so four ranking are there: Q1, Q2, Q3, Q4. If your article is published in Q1 Scopus journal, it is more than a PubMed index journal. So it is not easy. So you have to make sure that you are focusing on this. H index is what? H index is the journal and authors. So suppose my H index for today is 3 or something, which is which is based on citation, productivity, and impact on the society. If your work is impacting on society, then your wonders are there. There are few people in our yoga. I'll give an example of Dr. Raghavendra Rao. I think his H index is almost 28. So it takes years, that how much productivity and impact you are creating in the research journey, then your H index will improve. That also gives you an idea that how much good your paper is. So for your first paper, if you are a new researcher, a trusted, indexed, in scope, have a good rate that can be submitted to a good journal. Okay. So where work likes the International Journal of Yoga, where you can submit yoga research, mechanism, therapy, which is PubMed index again. Then Journal of Ayurveda and Integrative Medicine, which is from elsewhere. Medical acupuncture, which takes about clinical acupuncture work and all. Advances in Integrative Medicine. Journal of Integrative and Complementary Medicine. I am giving you 6 papers name. There are so many, but these all are indexed there. If you see below to their heading, their massage, manual and movement therapy means what? They are giving a idea where they can, the scope and aim is. Again, now this is a website called thinkchecksubmit.org to make sure that where you are submitting is not a predatory journal. What do you mean predatory journal? It looks same like original journal, but it is not an original journal. So making sure that if you get a call from an email, okay, please submit your article in our journal, please do not. First red flag. Promises publication in 48 to 72 hours. Not good. It is not good. Again, I'm telling you, hidden fees are there, no clear editor information, no real address of the journal. Scope is not there. They can accept anything. If you are submitting your article in these kind of journals, I'm saying your research career would not be there. Make sure that your single article should also not come in a predatory journal. If you are blacklisted in the publication, then you cannot submit for the years together a single paper. So making sure that these red flags, because many people, we receive every day few mails, okay, you are a so esteemed researcher, please give your paper, we will publish in so and so date, and we will charge you 2000, 10,000 rupees or something like. They are not good. Okay, if you have to see the open access journals, open access means anybody can read, not subscription based, anybody can read. For that you have a website called doaj.org. Okay, so and if you have to see retraction watch, retraction means what? If you have submitted your journal and that article is not good, then your article will be retracted, means deleted from the journal, and you will be having a red flag on your name. So you cannot submit your article in another journals. This is not easy thing. This is a very, very important thing. Protect your year of work. If you cannot protect, then anybody can use your ideas. Again, so open your phone, think. So, okay, so you have a submission within 3 days, or you have worked on narrative review, check one journal, read about aim and what is scope. You do whatever you can do on that. Just go through all the information, what we have seen here on this slide. Scope, audience metrics, indexing, author guideline, and APC. So I would request everybody to read all these six things in any of these journals, or you can find a new journal also. That's not an issue. And then you have to check thinkchecksubmit.org for the journal checklist. Pick a journal that emailed you. Okay, if you have something, then you can find out whether that journal is good or not. So it is your task 4. Please make sure that we have less time now. Okay, submit. So we'll focus on this. Just take 1 or 2 minutes to just go through the website of any journal. Yes, Dr. Vinay, can we proceed further?
Yes, sir. We'll proceed.
Okay. So now next is, there are three things. If you have selected your one journal, I would say select 3 journals. Okay, why? Because when you submit an article to any journal, they might have more articles or they do not like your work. They might reject it. Okay, and they will give few comments that why they are rejecting it. So you can go for the next journal. Then if they reject, you can go for the next. That is the approach you should have, that you should shortlist 3 journals basically. Okay, now there is a one website called jane.biosemantics.org. What you have to do is you just paste your title and abstract, title or abstract. It will suggest you which journal is good for you. It is a very big issue that we do not know what journal we have to work on. So there is a website called jane.biosemantics.org. Put your title into that. It will give you the possible, it will give you the possible journals where you can publish your articles. And again, I'm saying you have to select 3 journals. Okay. Again, what you have to do is publisher journal finders. So I'm giving you few websites. That is, one is Jane. If you are not able to find from this, then you have to go to elsewhere website. Just write your title. Then you will also get the few journal name. Springer, Wiley, Taylor and Francis. Just paste your abstract or your title. They will tell you where it will get fit and scope. Okay, so it is very easy. So I told you that you have to find it, all these journals, but easy way to find it. Again, 3 journals you have to find. Top one is first, second, and third. There is two kind of approach you have to see. One is Jane, second is from the publishing website called Elsewhere, Springer, Wiley, Taylor, and Francis. Okay, the Lancet and Nature. Again, these are the 5 to 6 publishing agencies in the world. If you write your title or your abstract, if you paste your abstract, it will give you a right approach where your journal or where you have to submit your article. So maybe it is very clear. Make sure that Scopus is also having a journal list, master journal list. So Scopus will tell Q3, Q1, Q2, Q4. So you can confirm either 3 of the way. So how to find fast? There are 3 ways: Jane, publishing finders, and the Scopus. So all these 3 things should be there with you to find a 3 journals. So now you have to submit it and you have to survive the review. There is one good thing I'll tell you. Most of the journals nowadays suggest a peer reviewer. Means you submit an article to any journal, it will go to the anonymously without your identity. It will go to any random three reviewers. Suppose it came to me. I do not know whose article it is. I have to read the article. I have to review from introduction whether it is correct, abstract is it correct, result and all. I have to read it, review it, and send it to the journal. Then journal will give you that we have sent it to the peer reviewers. They have sent few comments. Kindly improvise it and submit it again. If not, reviewer says reject, it means it will be rejected. But nowadays, journal asks you the name of suggestion of the reviewer. I would say that please suggest your seniors or the person who is expert in the community. So it would be easy because if they send to someone unknown, it might be possible of high rejection. So making sure that you give the right person name and email ID so they can send your article to a right person. Now, these are the major issues. So if you have written a paper also, the journal will ask you to write a cover letter, editor desk check, peer review, decision, and revise and submit. When you start submitting your article, they will ask you to write a cover letter. You have to write one paragraph to the editor. Like how we write an application to the principal about leave. You take a leave now, so we write an article letter. So same thing, you have to write a cover letter to the editor of same journal name. Subject is submitting one article, which is a case report or a original article. Now you have to tell what it is this article in one paragraph, and that also will attach as a cover letter. Second, you will have a title page. What you have to do in title page? The title page you have to write about title, authors, who is corresponding author, who is first author, second author, third author, fourth author. So corresponding means who owns the paper. Suppose if I am a corresponding author means if anything happens from the result or discussion from that paper, I am responsible. So corresponding author has all the responsibility. Then based on your work criteria, the first, second, third, fourth authors will come. So in the title page, title, authors list will come. Okay, 1, 2, 3, 4. Then you will have how many words article it is, how many figure, how many table. Then you have to write acknowledgement. If you want to acknowledge anyone, you have to write funding. You have taken any funding from anyone. Then you have to write checklist. So all these things will come in the title page. Okay, so then your paper, when you submit, it will go to the editor. Editor will review whether you have submitted properly or not. Then it will go to the peer review. 2 to 3 experts will critique it. Okay. Then it will go to the decision, whether minor revision, major revision, reject. Most of the time it comes for the revise, but if your article is not at all good, then it will be going as a reject. Then you have to revise it. If it comes as a revise, then you have to revise every point, what the reviewer has asked you to do it, and then submit it again. Then you might get a good news that they want to publish your article. So answer reviewers like a scientist. Be grateful, do not be defensive. Suppose they say that this word is not good, okay, or whatever you have written is not good, then do not defend yourself. Just say that, thank you, sir. We are working on it and it might be a limitation for us. So like that you have to write, and you have to reply point by point. Show the change. We have added page number 4, line 12. Exactly what has been asked, you change it, highlight that point, what you are changing it, and disagree respectfully if you are not able to answer anything. Okay, sir, this is what I am not able to find, but this is, and then submit it again. So I will not ask you to do this. Okay. So example is yoga nidra cuts insomnia's severity in shift nurses. It fits in iJoy focus on applied yoga therapy. So it is like on your phone, if you can find whatever the idea you have chosen with journal. Okay. So why beginners papers gets rejected? Why our first slide was not a clear question, wrong journal, intervention not described as per tider or stricta, over claiming. You say it proves and all, nothing doing like that. It improves, nothing. You say the change is of this much percentage and all. Honest limitation should be there. You should not ignore author guidelines. Make sure that simple English proofread should be there by your seniors or a guide, and make sure that plagiarism should not be there. Okay. So if you have any unfinished manuscript, okay. So now today you have seen equator checklist, limitation paragraph. All these things should be there. Okay. If it is a systematic review, please register on a website called Prospero. Okay. There, whatever the search history you are doing in your systematic review or narrative review should be mentioned in the article. Keywords, search options, and should be follow the Prisma checklist. So I have heard that you have a time is not there, so many things we are not going to discuss today. But I would say that you have your phone, you have IMRRD structure. There is a website called crd.york.ac.uk/prospero. This is for your systematic review to submit your proposal. It should be registered in Prospero before submitting to any journal. Okay. So example like half done yoga for anxiety review. Next, register on Prospero. Draft Prisma follow. Okay. So we have understood this. So you have a toolkit. All these toolkit you should save in your bookmark today. So this is your next task. Open your phones. Last task. You have a bookmark in your phone. You should have all these website in your bookmark. Equator, DOAJ, ICMGE recommendation. Okay, ICMGE will tell you how you will get authorship and all. Scopus, Jane, and Think Check Submit. So Dr. Vinay, are you there?
Yes, sir.
Yeah, so ask them to just put a bookmark in your laptop or phone. So all these websites should be there in their bookmark because that will allow you how to submit and how it will help you. And PPT I'll share with you all. So you can take as a reference in the PPT also if you need anything. So just do it. We'll give one more minute and then we will try to close it.
So we can proceed. They have noted it.
Okay. So with this, if any doubts are there, we can take it. And I had one more work which I wanted to tell you how you will write it, your result and discussion. Because time, I think time we are 3:30. We have to close now, Dr. Vinay.
Yes, sir. Yes, sir.
Yeah. So we will share the things. I'll take 5 more minutes. I'll try to just show. Okay. I'll just show you 5 more slides. Is it visible?
Yes, sir.
Yeah. So I just wanted to tell how your title, everything should be. Please take screenshot or if you want, I'll share the PPT. So how your title should be. So a good title says what you studied, in whom and with which design. So if you see a weak title, effects of yoga on health and something like that. But if you write a strong title like that, effect of 8-week pranayama on ambulatory blood pressure in adults with stage 1 hypertension and RCT. So you have a intervention outcome population design. So like that you have to approach. When you write an abstract, the whole paper in miniature, which you have to focus on background. Why? That question should be answered. Methods, design who, what, main outcome, key numbers, effect size, confidence interval, and P. Only these three things should be there in results. Conclusion in one line. Mostly you have to submit in below 250 words. No citation, no abbreviation. You do not define anything in the abstract. Keywords. It is a very, very important thing. Make sure that whatever the keywords you are choosing, it will derive that how your paper will go in future for the citation. Because PubMed, you all will search pranayama, hypertension, blood pressure. That time your paper will come if you have approached or written a proper keyword. So keyword is like a be discoverable. So if you want to be a discoverable from an author side, then you should use the, so 5 to 8 fellow researchers should use a PubMed related what you say keywords like pranayama, hypertension, blood pressure. You would like this, it will help you to find the right papers. Introduction you should write in 3 stages. First is what is known, gap, and then your aim. So writing these 3 moves will help you to complete the introduction within the 500 to 700 words. In methods, what you have to write, design or setting. RCT or cohort, you have to write where you are doing this, when you are doing this, when you got the ethics approval and CTRI approval, that number you have to mention. Then participants. Who is the participant? How many? How you are recruiting it? Again, tighter or stricter? The dosage, asana, needle, diet, minutes. You have to mention outcomes, sample size. In most of our articles, in what I say, I've seen in most of the articles which is getting rejected. And when we rework on those things and we submit it again, what happens that time? The sample size is not calculated very well, and the sample size is not mentioned very well in the article when you submit it. So that those things should be very proper. And what software you're using for statistics? Please do not report impressive as expected or repeating every table value in that next text. So if you do something write in text, then do not write in table. If you write in table, then do not write in text. Follow the report effect size, CI, confidence interval, and p-value. In your table, these 3 things should be there. Put dense data in table or figures, not write it, and report dropouts and adverse events honestly in the numbers also. Discussion, please, if you are writing discussion, narrative review, please write all these 5 points in your head. Key finding, the first paragraph. Comparing with the previous literature, second paragraph. Mechanism, third paragraph. Limitation, fourth. Fifth is implication. If you write 5 paragraphs in 500 to 600 words, you will have the best discussion. So in key finding, what you have found in your study, agrees with previous literature or not, differs on what and why. Mechanism, if you have, try to write it, a hypothetical mechanism if you can. Limitation, please make sure that limitation is there, and implications. And naming your own limitations build trust in the future researchers. Referencing depends on the journal. Okay, Zotero, I would say that I use Zotero. Zotero is very good and easy to use. One more thing, everybody is using AI. I do not get time to talk on AI. I need another 2 to 3 hours that how you can use AI in research. We can use AI in research, but there is a way. And that way should be described in a such a way that you can improve your proficiency and efficiency in submitting an article. Okay, do not use ChatGPT and all directly, because there is a tool called Turnitin which can detect that how you have written your article from which AI tools, and you will get rejection. So please do not practice like that, and never fabricate anything. If you are fabricating the citations, data, if you get caught in that fabrication, you will be banned from submitting an article. Okay, so I would say that the time is not there, but yeah, I'll ask you to this cover page I have discussed, title page. So these are the 6 files you have to upload when you submit a paper in any journal. Okay, so what you have to do: ethics, consent, registration, conflict of interest, author's contribution, funding, AI use disclosure. So in title page, all these things will be there. What and all? Ethics, registration number, conflict of interest, author's contribution, funding, and AI use disclosure. that what AI tool you are using for what. Cover letter, as I told you, dear editor chief, what you have worked on, like we write a leave letter. Okay, what it is. So next is, please check, uh, jargons are not there, numbers are matching, terms and tense should be there, and read it loud that whatever you have written, it is clear. Okay. You write in your own words. Similarity, Turnitin is a tool. I think your institute might be having Turnitin to check for plagiarism, that your work is not copied and pasted from someone. Okay. Pre-submission checklist. Please take a picture. Article type, title, all the titles, like each section, figures, required statements like ethics, funding, and all, trial number, CTRI, Prospero number, cover letter, all these things should be there, and at last proofread of your references manuscript by some other person. So please do not write vague abstract opinions, interventions you cannot repeat, no limitation is stated also is a problem, or generic thing you cannot write. And please write registration numbers like ethics, Prospero, and all. Again, we have all these discussion. Yeah, so last is write it, polish it, and send it. Again, if you want to approach me, I am available on LinkedIn, Instagram, anywhere in social media, where if you want any help or any suggestions, we can discuss through your principal, sir. So we will keep in the loop, Dr. Puneet, sir, and we will work together. If you have any ideas where you are finding it difficult, today was a very brief time of 1.5 hours, so we cannot discuss many things. But this is an idea that how much depth we have to go in each and everything. And if you have any doubts, any concerns, uh, you can just email, call, or approach via LinkedIn or Instagram, anything. You can just put my name, the profile will come, and you can approach, and we'll try to help you in all possible ways through your principal. Again, I'm telling you, through your institution. So please make sure that if you have any idea, can narrative review you have written, and if you want to convert it into systematic review, you have idea about doing a small trials, we all can do all these things. Think about it, try to do as ethical as possible for the longer journey in research. And all the best to all of you. If you have any doubts, we can take it. Otherwise, thank you once again, everyone, for your time.
Thank you, Dr. Bhavit Bansal, for your valuable time and insightful session. On behalf of the Yanapaya Naturopathy and Yogic Science College and Hospital, we sincerely thank you for joining us today and sharing your knowledge with us. Thank you once again. Have a nice day.
Thank you, everyone.
Thank you, Bhavit sir.
Thank you.